to ask for your permission to use this video for educational purpose on the internet.
Yes, you may.
Why don't you describe your symptoms before the surgery?
I could stand roughly 2 to 3 minutes, and I could walk roughly 2 to 3 minutes, and then the pain would get so severe I would have to sit down
So you had
to relieve the pain.
Wow, okay. Well, we would call that claudication symptoms. We have a name for that. And that is based on your spinal cord being narrow, which we call stenosis. And we confirmed that with imaging and so on. So you had the claudication symptoms, and you could literally just go on for a few minutes before the pain would make you stop. For how long has that been going on?
It got progressively worse prior to my surgery, 3 years, 4 years prior to surgery. So I had it quite a while, and it just got bad enough to where about all I could do is just sit.
And you're a tough man, going on that long with that. And what do you do for a living?
I ranch
And
full time.
that explains why you are a tough man.
And also I work as a walking letter carrier
Lots
for
of
the
walking.
post office as well, part-time. So I did a lot of walking, sometimes up to 13 miles a day.
Wow. And how was your work life before the surgery?
It was altered drastically. I was limited on what I could do and how I did it, and I became very creative in getting my work done and altering my lifestyle to have the work get done.
So we did the surgery about 6-7 months ago. When did
About
you
7
7 months ago. And how long did you stay in the hospital?
I was in Maple Grove, and I came out of anesthesia, and as soon as they felt like I was able, I was out of there. So my wife knows, I think it was several hours.
So few hours after surgery, you did go home. You didn't stay in the hospital.
We went home and we drove.
So how long did it take for the leg pain and back pain to subside and getting better?
Immediate.
Okay.
It was immediate. After I was able to stand or walk a little bit at first, after surgery, which was very soon, I realized there was none of the leg or back pain anymore. I was very careful, but as it didn't 6 weeks, I was becoming very active, not lifting, but just being very active and doing
things. So within
things.
6 weeks, you were back to your work activity, and you were functional.
Pretty functional and
Excellent.
somewhat normal.
Excellent.
I was being very cautious on a number of things, but
and you still have to be more cautious for certain things and so on. But you were functional 6 weeks after the surgery, which I don't believe is a usual thing after spinal fusion. After spinal fusion, half a year to a year is what it takes for people to be truly functional. So, and the reason I think you could be so functional, obviously, you have a good healing process, but as well that we didn't destroy your back to get the job done.
Right.
And I'm going to just turn around and show what you had before the surgery, that you had the L3-4 Spondylolistehsis, stenosis, severe, very severe degenerative back disease. As a matter of fact, look at bone is grinding the bone, and the stuff of the disc itself decomposing inside of you. We did that surgery here. As you see, that surgery was done within less than 38 minutes, if I remember right. And we had barely a spoon or 2 spoons of blood loss. And as you said, you were discharged just a few hours after the surgery. Did you walk same day after the surgery?
Right. Yes,
Excellent.
I did.
Excellent. Well, I think this is pretty good result that we can achieve by not destroying your back. We can achieve the result not only better, but as well sooner. And again, you don't have a job like myself that is a desk job. You have a demanding job,
Right.
and we could make you functional. Well, do you have any comment, anything you want to question or anything?
The only comment that I would make is literally my life was changed from, I knew I would be sitting in a chair basically the rest of my life, and I'm too young to do that. I'm not willing to live that way.
Yeah.
And basically I got my life back,
Well,
is how I feel. I got
Thank you
my
so
life
much.
back.
You made my day.
My day's been made too.
Thank you.